right. Good morning, everyone. I'm Rebecca Treadway with the ARC Northwest Mississippi, and thank you for being here today with our ABA for Beginners session. I want to introduce my good friend DeTerrence Allen from Mississippi Behavior Services. And DeTerrence, take it away.
All right, awesome. Like I said, I'm excited to be here today. Like I said, we are providers in Mississippi, in North Mississippi, and so I think it's our obligation to empower parents. And so, as we've said before, this is not a parent training, it is a parent support. I'm here, when we talk about training, it's almost as if we're saying that parents are missing something. And as behavior analysts, we're really here to support the individual. All right, give me 1 second. Is everybody able to see?
Yes.
Yes,
Okay.
great.
So with that being said, I like to give the audience a little bit about myself. And so you're not just having this random guy come on and say nice things. And so with that being said, let me kind of give you a little background about who I am and what I do. Now the screen is froze. I'm a licensed behavior analyst in the state of Mississippi, and we'll go over what a behavior analyst is and how is that relevant to you and your family. Also, I have a Master's of Science of Instruction, Curriculum, and Leadership. I'm the clinical director for Mississippi Behavior Services, and we're located in DeSoto County, right off of Getwell Road in South Haven, and we're happy to support any family that's looking for behavioral or behavior support. Also, I'm the current president of the Behavior Analysis Association of Mississippi. The acronym for that is BAMS, and so we'll talk about what BAMS is and how that can be a great resource for you as well. I've provided 10 plus years of service to individuals with behavioral needs in North Mississippi and Tennessee. And so, like I said, my love and my passion for supporting families just really derived. I had a internship at a location that was called Helping Hands Learning Academy, and I was really geared to be a lawyer. And what I found was my just passion was being with kids and being able to support families, and then seeing those families achieve new goals and being able to see the kids achieve things that I never imagined. And so that's just how I got here today. And 10 or 11 years later, I've been in DeSoto County and in Tennessee, really trying to work and promote the needs of individuals with autism and also individuals with intellectual disabilities as well. Okay. All right, so our objectives for today. We're going to define what ABA is. We're going to also identify individuals that can provide ABA support, distinguishing between what's a BCBA, what's a BCABA, and what's a RBT. I know that there are a lot of acronyms that a lot of people will throw at you. However, I just want to make sure that we're able to kind of distinguish those things. And then identify the process for receiving ABA services, and also identifying typical techniques that occur during ABA sessions. So while we go through this process together, I will let you guys know I am not an expert. No one under the sun is an expert on anything. I have a knowledge base and experiences that I've had accumulated over the 10 years of me providing this type of support. And so we're navigating this together. So at any point, if you have any questions or any concerns, I want to make this a real dialogue so that everybody gets something out of it. And so the participation is always going to be welcome, parents. All right, so I'm going to ask everybody this question, and if everybody just kind of chime in as you feel. What do you feel ABA is, and what have you heard about ABA services?
I've never heard of it, so this is my first time.
First time?
Same here. I've never heard of it.
Okay. Hey, it's no problem. I think that gives me a canon of what we can kind of talk about and how we can kind of dispel some of maybe even some myths that you may heard about just behavior support providers in general. All right. So I'm going to give you this clinical definition, and it's kind of wordy, but don't worry, we're going to unpack it together. So applied behavior analysis is the science in which the principles of analysis of behaviors are applied systematically to improve socially significant behavior, and experimentation is used to identify the variables responsible for behavior change. While that is really wordy and really scientific, but in essence, in short, it's very simple. It's the science. It's a scientific approach that's aimed at producing socially significant change for individuals and families. And so this support and these services are typically geared in Mississippi for individuals with autism. However, there's multiple ways for you to gain access to what we call behavior support. And right now, could anyone, if they feel comfortable with sharing, your loved one, what age ranges are we looking at right now?
3.
6.
9.
8.
Okay.
My son is 15, and I'll just lend in to say that maybe since I did ABA with Ethan when he was younger, I see ABA as the therapy that took Ethan's behaviors from being not socially acceptable to being socially acceptable.
Well, I definitely agree with you, Rebecca. Looking at the treatment and looking at the process, and if you feel comfortable, can you tell me a little bit about that process for you? Okay.
So at the very beginning, when Ethan was 3 or even before that, he just was completely out of control. He was just everywhere screaming and yelling, and we couldn't get him to sit still, or we couldn't get him to eat at the table with us, or wash your hands, or comply to do anything. So I started looking for, and this was many, many years ago, before ABA was readily available. So I went down to the University of Memphis, and I was trying to find students or anyone to help me with ABA. And I found a couple of grad students that did some ABA sessions with me. And then I bought the textbook on ABA and started to do discrete trials myself at home with him, which I know is not anywhere near what you guys do now. It's so much more evolved and better now. But through the process of doing those discrete trials with grad students and with myself, it slowly changed his behavior. So he would comply, he would, follow directions and tasks, and it kind of brought him back to us.
And one of the biggest things that we see with ABA is, or just the applying the principles of ABA is, how to address some maladaptive behaviors. So whether it's having issues, or the parents and families can have difficulties during mealtime, can have difficulties during academic sessions, and also can have difficulties during just going in and out of the grocery store. And so what a behavior analyst or a BCBA will do is assess those behaviors, assess how is the best approach at getting the loved one from in and out of the grocery store without as many tantrums, assess how we can leave from a playground or a preferred setting to a non-preferred setting, going back to doing some academic homework. And then one of the biggest misconceptions that I've seen as far as that ABA is only for individuals that are in preschool with autism. Well, honestly, at our agency right now, we provide support for a wide variety of individuals and a wide variety of ages. And so understanding that ABA is a set of principles or methodologies that we can utilize to reduce some of those problem behaviors. And for me, the reduction of those problem behaviors is significant, but what's even more amazing is the skill set that we can teach those individuals. And so that means, I can teach Johnny, or I can teach Ethan, or I can teach whoever my loved one is, to be able to ask and say, hey, mom, grandma, it is too much for me can I get 5 more minutes to do A, B, and C? Or can I get 5 more minutes on my video game before you ask me to do my long list of chores? And so facilitating that communication and developing language is a crucial component of ABA in what I do as a behavior analyst. So with that being said, loved ones, can y'all tell me what are some things that you struggle with when it comes to challenging behaviors right now?
Screaming, defiance.
Yeah, and I can give you an example of that. Part of the reason that I took another look at this and I wanted to really participate in this is because I have an 8-year-old and he is a model student in school. I mean, he is really good, really smart and all of that, but it's really at home where I get, the acting out or he doesn't want to do something. Just last night, he had a tablet and I told him, okay, and it was my fault. I told him kind of abruptly, okay, we're going to have to put the tablet away because we do Friday night movie nights. I'm like, we're going to have to put the tablet away for the rest of the night. And he had a problem with that. He threw the tablet, threw his glasses, threw my glasses, and just really took it further than he's ever taken it. And we had a long bout with that until he calmed down and we prayed together and I just got him to calm down. But I was like, okay, you're getting bigger and older and we're going to have to make some changes about some things. Because I think about the consequences in the future. I was like, okay, we're going to have to change some stuff. Yeah. Your behavior, I didn't say this to him, but his behavior is going to have to be modified or something's going to have to change. Yeah.
And just like I said, my perspective, like I said, all the things that we talk about here are just some anecdotal things that may help in the home. But I'm always going to refer you to get additional clinical support from a board certified behavior analyst. And so, but I think that as you talk, I can feel the passion and the distress that happens during that. I mean, I can just imagine you're trying to figure out what to do in that moment. And it can be very frustrating. It can be very overwhelming to know that my loved one, when they are at school, things are so much easier for them. It's so much easier for them to comply and be able to do what other individuals have asked them to do. And then we look at what may be some underlying effects. So things that may trigger some of those behaviors may be rooted in looking at the home environment. And so is it as structured as school? I would venture to say at home as parents, we are never as structured as what school is, because they're able to program for, at 8:15, you have to be here. At 7, at 8:45, you have to do A, B, and C. And so our loved ones are able to kind of then anticipate what's going to happen. And so what we have to do is, this is a teachable moment. And so looking at, what, we need to periodically change our schedule at home and say, hey, but on Tuesday, Thursdays, we may have movie night, but we may not. And so we'll insert what we call an uh-oh card. And this uh-oh card is, it's also a signal for him to know that, hey, you know what? The plans changed, and now I have to be okay with the plans change. And then also being able to give him the tools by saying, hey, I noticed that you're very frustrated right now. Let's talk about it. What are the factors that causes your frustration? So do you want more time doing whatever you're doing right now? What was he doing at that particular moment when you told him that it was going to change?
He had the tablet. in his hand, and
Uh-huh.
it's my fault because I really let him have that. Anytime he comes home after school, I did give him a set time. I did give him a set time for a while, and then I stopped doing it. And I backed off of it, and he comes home. We do something together for a little while. Then I tell him, okay, you can go to your room. And before he goes to his room, he comes to my room to get the tablet and goes to his room. And so I changed that. Or I haven't been as consistent with it. Like, there were times I wrote it down exactly, okay, Tuesday and Thursday, like you said, we do tablet, and not on Fridays. But I haven't been firm with that, and I just let him have the tablet. And now he's probably like, okay, you're taking my tablet away. And
Well,
and he is so to the point that he's like, okay, I don't want the tablet. I don't want it ever anymore. And now he backed up off of that, and he said, okay, I get the tablet. I get the tablet, and I can't have it for 2 weeks. He actually puts the structure in there.
yeah.
It's, you know,
So he's actively looking for some set of regimens.
yeah.
And honestly, in this day and age, the only thing that we can anticipate more often than not is change. And so with those things in the environment frequently changing as parents, it is our duty to kind of prepare them for a changing world. And you think about, and I guess the best example would be the onset of COVID. When you looked at COVID, I mean, everybody's routine was thrown out of whack. You know, how you went to the grocery store, how you did, you know, even shopping has changed. As a male, I hadn't had any interest in shopping, and now I find that my wife is shopping online more than ever. And I'm like, hey,
Yes.
you got to stop this. And so all of those things were routine changes that were not accounted for. And so I remember that stress of, okay, well, how do I do this now? Or how do I navigate now? I need some type of regimen in place. And so with that being said, it's almost like being able to teach inconsistent schedules. And so the way that we do that is by periodically giving changes in schedule to that individual under our control when we can fight that battle. And so if we're talking about practicing changing schedules, you wouldn't do it 5 minutes before you wouldn't practice that skill 5 minutes before it's time to go to school. You got to find the appropriate time of day to do those things. And when you have the ability to sit down and address that tantrum, let me ask you this: when you changed that movie schedule, was there something kind of impeding that or some reason why you changed the schedule?
Yes, it was my own thinking. He had the tablet, and I was like thinking about his eyes. He had problems with his eyes, and he couldn't see something. And I was like, that's what he needs. It was my own thinking. I was like, he needs to not be in that tablet so much. He has it every time he moves around. So I gotta, you know, COVID is, I mean, he had it initially at first. And I was like, okay, you can have it now because I understand you're an only child. You need something to kind of work with, and that kind of helps you keep structured and peace. And, you know, so I let him have it during the whole time. But as he was getting back to school, I told him, okay, we're going to start structuring things, and you won't have the tablet all the time. So I did tell him, but I did not put something in place to say when I would take the tablet away. And
let me ask this, other parents and caregivers.
Sure.
What have you guys done when you've experienced something as removing something preferred away?
We end up having a big battle.
Yeah.
Punishment for me for probably a couple of days. Sometimes it works, sometimes it don't.
There's
try
always
to
going to
put
be like
parameter. Oh, sorry, go ahead.
no, Becky, you go ahead. Go ahead, Becky.
I was gonna say we try to put parameters around it. We're not always consistent, but you know, we try to limit to times of days and keep a routine with preferred objects, especially you know, Jarrett loves his devices too. And then when we know we need him to transition from that to something else, we try to give warnings. So, you know, 10 more minutes, 5 more minutes. And when we can put something visual with it, that tends to help too. And then we try to make the non-preferred activities seem to be more fun. Like we get excited about, we're going to brush our teeth, yay! And he's really social, so sometimes that works, sometimes it doesn't. But it's just kind of trial and error for us.
Yeah. So a lot of times what happens is we see, and I'll say this, one tantrum is not necessarily the end of the world, but 2 tantrums at least gives a common denominator. 3 tantrums is a trend when we've had 3 tantrums for the exact same reason. And so with that trial and error, I think you were able to then see, you know what, hey, when I present something new, I need to give those verbal warnings. Then when I'm able to make it fun, so finding a way to socially increase the value of whatever you're going to go do. So even if it's going to go do math work, and my kids hate math work. My daughter absolutely hates it. She will tell me, hey, Dad, this is not what I want to do today. Can I do something else? And even with that skill set, I still am throwing a party when we get to the table to do our math. I may say, you know what? If we get all of our math problems right, there is a shopping spree that's going to happen at the end of the day. And those are things that we've done to kind of encourage and make that transition smoother. And then also looking at visuals. When it's applicable, when we're able to kind of give those visuals. So whether it's having a schedule on the refrigerator saying, hey, you know what, you have 15 minutes of iPad time each day, and that those 15 minutes of iPad time are contingent on you doing, you know, at least 1 hour of reading, a little bit of time of cleaning, and something with your brother. And so I have 3 contingencies in place that are going to encourage and incentivize appropriate behavior to get access to the things that we want. But also looking at sometimes with all the planning in the world, we have moments where it's critical that, you know what, I can't prompt you, hey, bud, here we are. This is a unplanned schedule change. You know, Mom, I have a meeting and I have to get to this meeting right now, and you have to come with me to this meeting. And so now I'm prompting as I'm going and saying, acknowledging, saying, hey, bud, I know that you hate this right now, but this is how long this schedule change is going to last. And so giving the individual a clear expectation of, you know what, hey, you're only going to be without, I know you typically get the iPad for a whole hour or 3 hours today, but you're only going to have access to it for an hour. I'm sorry, bud, but this is how you can earn those things back as well, though. And so as well as accounting for the schedule changes, also accounting for how we can get that person back to a sense of normalcy.
Hey, DeTerrence, I want to lean in for a second. Robin, am I correct that your little ones are 3, right?
Right,
And they're twins,
right.
and they both have autism. So I think if you could maybe just address Robin for a second, because since we've been talking about kids that are a little bit older that have a little bit maybe more linguistic understanding, can you throw a moment over to Robin with the younger child?
Perfect. All right. So Ms. Robin, if you can just give me a little bit of details, just tell me what are some things that you've experienced and maybe a behavior that is challenging for you.
Tantrums.
Tantrums.
Bad tantrums, both of them. Aggression. I mean, everything that Rebecca said is almost identical to what we're going through.
What are some of the like things that are common triggers? So what if is it, leaving?
Anything and everything. It just depends on the mood at the moment that it occurs. They don't have anything specific that triggers that we've been able to determine other than toys and the fact that brother does not like to share anything.
Yeah. You know what? And I will tell you this, Ms. Robin, it's not uncommon. And with preschoolers, 3-year-olds, that is the prime time for individuals to learn the behavior of not sharing.
Well, that part we understand. I mean, these are my grandbabies that are in our care. And we understand, I mean, I've raised other children and other grandchildren. They're the youngest. But theirs is just simply out of control. I mean, they will actually hurt one another to obtain whatever it is they think that they have to have.
So, and it happens across all settings, right? So,
yes.
So no matter what you're doing. So what we'll do is we'll kind of unpack some specific situations, and then it won't necessarily give a remedy for every encounter that you will have. And I would think that trying to connect with a ABA provider is going to definitely give you an extensive plan of action.
Right. We're working on that.
And with that being said, I think if I explain what the process is of achieving and what a BCBA is and some of the other aspects of behavior analysis, this is going to give you the tool set to be able to navigate those resources. And
right.
Rebecca, I would love to have a discussion with you even after our parent training to look at, or parent support to look at connecting you with viable resources as well. Perfect, Ms. Robin. I'm gonna get to this next slide, and then we're gonna come back to some of the questions that you have. All right. So, who can provide ABA support? So, in Mississippi, our state government has statutes that regulate the practice of behavior analysis. The governing body is named the Mississippi Autism Board. Currently, M.ED has licenses for the following professionals providing behavior analytics services. So BCBADs, BCBAs, and BCABAs. And I'm going to also list a link to connect with the Mississippi Autism Board. They have a list of licensed providers that are on their website. And so you'll also be able to see that. And I will also give you guys access to BAMS, which if you navigate their website, you're able to see a list of clinics in North Mississippi that provide support as well. Okay. So please note that individuals with RBT credentials are an extension of BCBAs, therefore are not registered therefore are registered under the BCBA. So a lot of times what you have are paraprofessionals that are interacting with you on a daily basis, but their programming and their training is responsible by what we call a BCBA. Okay, so it's a lot of acronyms, I know. I think if we can start unpacking what those acronyms mean, and then that'll make some of this stuff will kind of make a little bit more sense as well. So a BCBAD is a BCBA with a doctoral training in behavior analysis that may that may receive the designation of a board certified behavior analyst doctoral candidate. And so this just means this individual has doctoral training in the studies of behavior analysis. So they are really extensively geared at developing and training other individuals at providing behavior support. Okay, the BCBAD is not separate certification that does not grant any privileges above beyond the BCBA certification. So just because you can seek out and find a BCBAD or a BCBA. They are equivalent. Everything that the BCBAD can do, the BCBA can do. So whether you get a master's level or a doctoral level, they're able to function and do all the same practices. Okay, If you're certified at the BCBA level, you function at the same capacity as the BCBA, i.e. as an independent practitioner who provides behavior analytic services and are required to meet all the BCBA maintenance standards. So all this means is these are just the qualifications of what a BCBAD is. And so I think that understanding who the providers are and what level of provider you need will definitely help you navigate the field as well. Okay. Because I want to get to some of the Q&A at the end of the presentation, I'm gonna carry on. All right. So a BCBA. A BCBA is a board certified behavior analyst, is at the graduate level. So this means that person has a master's degree in behavior analysis. And they also have passed a certification test that allows them to independently practice as a provider of behavior analysis. So this just means that they took a nice fancy test, and now they're able to have a certificate that says that they can do this type of therapy. And one of the things that we look at is you can have individuals that are BCBAs, but you want to find individuals in Mississippi that are LBAs. So a licensed behavior analyst. This means that they have been sanctioned or they have the license to practice in Mississippi. And so what you find is there's a national board. The national board says, which is the BACB, gives us the power to practice. The state gives us the avenue to practice in Mississippi. And so knowing the difference between the two is going to mean the world of difference as well. Okay, any question about what a BCBA is? Okay, also a BCBA may supervise the work of a board certified behavior analyst, assistant, a registered behavior technician, and other professionals who implement behavior analytic services. So a lot of the times what you'll have is the BCBA is going to write and develop and do the assessment of your loved one in regards to the challenging behavior. And then they're going to, if you're coming in clinic, they're going to train the technician or the BCABA to directly implement the procedures or the techniques. And then from there, the BCBA is going to monitor and supervise that treatment package. And so a lot of times families may think that the technician is the direct contact, while they'll see the technician a lot more than they'll see the BCBA. The BCBA is the driving force. Okay. Also, there are what we call BCABAs. And so this is a board certified behavior, a board certified assistant behavior analyst. And so this is an individual at the undergraduate level that has the certification in behavior analysis, a professional certified by the BACB. And so this means that they at least have a bachelor's level and they've passed their certificate test to say that they can practice and assist behavior analysts. Guys, I know this is a lot of acronyms, but I think once we get through it, it'll make sense a little bit more. Okay. Professional certified at the BCABA level may not provide behavior analytic services without supervision. So this just means that they need to be supervised. This is not a standalone certificate. All right. This is the fun one. So what we have here are what we call an RBT. The RBT is the Registered Behavior Technician, which is the paraprofessional certification, and the minimum standards include this person just has to have a high school diploma. They will go through a 40-hour course. They will go through extensive training with the BCBA, but ultimately they are the direct implementers of the behavior support plan. You also have where they will directly implement in these strategies inside of the clinic, but there also will be the liaison in collecting data for the behavior analyst and a key component in making sure that services are continually rendered. Okay. Any questions about what those acronyms mean and how they apply?
Yeah, I have a question. The technician that you mentioned about the BCBA, initially there was a technician that would assist them. Is this the same technician that you're talking about now?
No, it's a BCABA, which is an assistant level. And so this means that they have a bachelor's degree, where a RBT has a high school diploma. And the rigor of the RBT is different than the rigor for the BCABA.
Well, I guess if you go back to that other slide, you mentioned something about a technician assisting the BCA.
This one right here.
Yeah.
So this is called the Board Certified Assistant Behavior Analyst. And so
it may have not been this one. It may have been another one, the slide before that. You mentioned the word technician, and I wrote it down because I was going to ask you what the technicians do.
Okay. So to clear it up, there are two types of technicians or assistants that the BCBA has. And it's the BCABA, which is this certification. And with the BCABA, you'll notice that they are an undergraduate level individual. So they've got a bachelor's degree in a science that's approved by the board. Okay. And then with the second technician that helps, this is just a varying degree of support. The RBT is a high school level individual or a high school individual that has a high school diploma that's able to support and implement directly a behavior support plan. Does that help clear it up?
It does a little bit.
Okay, perfect. So we have 2 degrees of assistance, like I said, the BCABA and the RBT. All right, so with that being said, I want to talk about how you can kind of connect with support. So while the process of getting ABA support may seem frightening and sometimes overwhelming, however, here are some tips in gaining access to ABA support. So first, you want to ensure that you, in Mississippi, to get support from a individual or to get the insurance company to pay for it, you're going to have a diagnosis of autism. And so if you're looking to get, any of your commercial insurance, so Blue Cross Blue Shield, Cigna, TRICARE, and also Medicaid, if you're looking for any of those providers to provide the service, you have to have a diagnosis of autism. And then after that, you will need to connect with a provider. The provider would need to be either a BCBA-D or a BCBA. And so this just means that bare minimum, they have a master's degree and they have passed the national certification test. And then from there, the provider will conduct what we call an assessment or a functional behavior assessment. And this is going to determine the level of support that your loved one will need. And so the level of supports range from, some people are getting an hour, some people may get 40 hours a week, depending on the intensity and what the recommendations of the provider suggest. And then from there, the provider will submit a request to the insurance agency. Guys, as a clinical director, fighting with insurance companies is a hassle. So sometimes getting that approval is not just as easy as me giving them the assessment. Sometimes loved ones need more support, and insurance companies are stingy with providing that or rendering payment for those things. And so don't get mad at the provider. We are trying to navigate the system as best as possible. I think that at a later date, we have to talk about how we can advocate for getting the supports approved at a quicker rate and making sure that they're reimbursable by insurance companies, because our families do need these supports. And it is heart-dropping when families can't get these supports just because of semantics. And when I say semantics, we're talking about things that are trivial at times, but it's the letter of the law as of right now. And then from there, being able to obtain treatment. And so what treatment will look like, either clinic-based or home-based support, where a BCBA is coming in and training the RBT and the families on how to implement procedures from the behavior support plan. This is just a package of techniques that will be geared at reducing some of those problem behaviors. So like Ms. Robin, you were saying that it's happening, all the behaviors are happening across all settings, and it's getting intensified throughout the time that you're with your grandkids. And so once we have that assessment, then we're able to unpack and then give specific procedures on what to do for those problem behaviors. And so that way you're able to kind of, on a foundational level, you're able to see when one of my grandsons, one of the twins, do A, B, and C, I need to respond a particular way. Maybe I don't need to put them in timeout right now. Maybe timeout is reinforcing to them. Maybe this is a perfect time for me to teach requesting skills and waiting skills. And I would venture to say some of the times when it comes to sharing, it's a matter of the loved one not having the skill set to wait for a particular toy. Rebecca, can you, when you've had experience with waiting with your child, what does it look like?
So back in the day where it was so terrible, yeah, I mean the waiting was just horrible, and it was trying to like in moments where he wasn't mad, it's teaching the skill in the positive moments. So talking about sharing or taking turns when he wasn't mad, or games to share. That's what ended up being successful. Where we all our family sat in a circle, and we all had a toy, and it wasn't even a preferred toy, and the game was just to share. Let's share. When we ring the bell, we're going to share. So making it something fun like that when it isn't a stressful moment was, I think, what turned the table for us. So being able to teach it at a calm time, and then when it's starting to be bad, don't you remember the game? I'm going to ring the bell and we're going to share. That's kind of, I think, what turned the table for us.
Definitely. And I think like what you hit on is being able to make it predictable. So when you ring the bell, there's a specific sound that signals that, hey, this is what the expectation is for the next 5 or 10 minutes. Contingencies of when you do share, this is how you share. So you have to be able to wait for your turn, and then finding games that are parallel in which you can share. Sometimes it's really hard to share this car because there's only one car, where it's easier to share the iPad. We can set the iPad in the middle, and then we can facilitate that component from there. I would love to hear Vargas's input on sharing. I think you have some great information when it comes to sharing. Not to put you on the spot.
He's on the spot.
I'm sorry. Hold on one second. I was hitting the team. Yeah, no, we're sharing. And I would like, I guess, to specifically address you, Ms. Robin, when it comes to sharing. One thing that we do within ABA, if you will, is determine when is the proper time to share. There's certain toys, there's certain times where, you want to covet your items. Now, I'm not saying that it's all the time, but what we have to do is teach different times to share. We also have to teach, why do we share? Because I think at the essence of all what we're speaking of is teaching empathy. Even when Ms. Antoinette was talking, we have to teach empathy within our ABA sessions. And by teaching empathy, I'm teaching a child why. So I'm teaching them why are they motivated to do certain things. And if we're able to do that, then we're able to open up so much more. And so that's what ABA does. You know, I heard Rebecca, when she was talking, saying that, you know, her child was receiving services so many years ago, the RBT certification wasn't even around then. You know, Rebecca, I think, was trying to provide. But now we have a systematic way of doing things. And so when I say systematic, I mean by doing the functional behavior assessments. And then we, as behavior analysts, we write those plans. And so those plans are saying, or those plans, if you will, give you specific ways to actually implement various procedures that the RBTs implement. So we will work on sharing in a one-on-one setting, and then we would teach the child when to share. And also then we'll bring in, let's say, your second grandchild, Robin, and say, okay, now, you know, we just taught this skill. Let me see you do these skills. And then we reinforce them for sharing. So one thing that we have to look at is reinforcement is essential. We have to be able to give someone something in return for doing something we ask. We all do this on a daily basis. We go to work every day so that at the end of the week, we can receive a paycheck. And so we're doing something for someone else. And so that's, again, those empathetic skills that we have to teach. And that's what ABA is about. It's about teaching socially significant behaviors and reducing problematic ones. And so I know DeTerrence gave this nice textbook, you know, definition of what ABA is, but in the essence, that's what it is. So we're teaching skills that are more socially acceptable within the community. It's not socially acceptable to tantrum when someone takes something away from you. However, the skill that we can teach is when you took that away, mom, when you took that away, grandma, that made me feel bad. And so we can work with that. We say, well, you know, I'm sorry that you feel bad, but this is what we have to do at the time. And so putting various visuals in place, you know, giving countdowns as well. So saying, look, you have 10 more minutes. And then after 10 more minutes, we have to do this. And then you're counting down from 9, 8, 7. So you're doing all of these different procedures. And, you know, I also heard earlier a parent saying that, you know, it was my fault. It was my fault. We can't necessarily think of it as anyone's fault. What we have to do is just teach better ways, if you will, to be more consistent. Because at the end of the day, that's what's happening. We're just not as consistent. And there's nothing wrong with that. Life happens. So, you know, sometimes you have to give an iPad so that you can go and cook dinner. Sometimes you have to give an iPad so that you can even go and use the restroom in peace. You know, so those are real life applications. And so what ABA does is teaches parents various skills that they can use so that they can handle life. You know, we all want what we want when we want it, but that's not reality. You know, and so as parents, it's our job to teach the kids when they can have something, when they can't have something, how to deal with various things that are upsetting as well. And so that's what ABA does. And so we break all of those huge skills down. So empathy is a very complex skill. There's some adults that still do not have empathy. And so what we try to do is, let's say, take empathy and break it down on a case-by-case basis. And so that's when you're working one-on-one with that RBT, that the behavior analyst has already written a plan that says this is how we're going to teach these skills. And so once that skill is mastered, then we can move on to another skill. And so it's almost like building blocks. And so we have to break down complex behaviors into very small behaviors. So sharing is a very complex behavior. Now, when we look at it, it's simply giving one item to somebody else. But think about the emotions, think about the thought process that goes along with giving something that you value to someone else for a period of time. You know, I can think about every time I go to the store and I have $5 and I want to keep my $5, but I have to give it to somebody else. So, you know, there's a lot of physiological associations that go along with sharing. And so we have to teach that child how to handle those situations. And I think I heard Miss Antoinette speaking, you know, when she said family night, she has on Friday night, she has movie night.
Movie night.
You know, and that's a, you know, be able to bring your kids, your peers together and sit at one place and do one task. I commend you for that. You know, I have two little ones myself. I have a 7 and a 5-year-old, and we tried family night for a while, but it didn't work out. But the thing is this, if you put those contingencies in place and you say, hey, on every Friday night, this is what we're going to do, remind them of Friday night is going to be movie night. So on Monday, hey, remember, you're not going to have as much time with your iPad because Friday night is movie night. So on Tuesday, you know, now remember, we got 4 more days until it's going to be that day for movie night. And so those constant reminders, and that's what ABA does. It gives you that skill to say, okay, these are the things that I need to do in order to achieve what we're trying to achieve. And I think, Ms. Antoinette, you said your child was 8 and he's not as smart as he used to be. That's the reality of this thing. And so we have to give various skills. We can't simply just muscle our kids into doing what we ask them to do, because one day they're going to be bigger and stronger than us. And so we want to teach those skills. And again, I know I sound like a broken record, but I think that's what ABA does. It teaches those skills so that we don't have to use, you know, physical restraints, if you will, in order to get a child to achieve what we want them to do. It's all about motivation. You know, we have to motivate the child. Rebecca, I heard you talking about making sharing fun, or, you know, unpreferred such as brushing your teeth fun. We're motivating that individual to do those things, because at a later date, when they're unmotivated, they can still rely on the skills that they were taught to continue to do those things, even without us being present. And, you know, parents, that's our ultimate goal, is for our kids to be able to thrive and do well, even when we're not around. And so that's what, again, ABA helps us to do. It trains us. It gives us the skill set to do those things over and over again on a consistent basis. So I didn't mean to talk so much, DeTerrence, but you asked me a question, I'm going to answer.
I was waiting. I knew that you had a lot of insight. Like I said, one of the things, or one of the aspects of our agency, not to kind of toot our own horns, is that we are very diverse when it comes to Vargas's appeal and my appeal. And so we really embody our mission statement, is just making meaningful changes and being able to support families in a way that they achieve the goals that they need. And so when Vargas talks about, you know, teaching sharing, this is not something that he's talking to you about colloquially. He's experienced it with his own kids. He's also has implemented these type of techniques with families in Mississippi and Tennessee. And we really harp on how can we better support the community, because it's tough. Being a parent with a individual with a disability is tough. And I can't imagine, you know, being in that situation. But what I can do is say, well, this is how we can help. And this is how we can better support our families in DeSoto County. This is how we can better train individuals so that they can make those meaningful changes. And Vargas, I know you may be living it on time, but how has that meaningful change been significant for you?
Well, you know, we started Helping Hands Learning Academy, which was an early intervention for children with autism here in DeSoto County years ago. And I think what I learned from that experience is that sometimes children need assistance even outside of that early intervention, because I think, and Rebecca, you can probably back me on this, when services first got started here in DeSoto County, it was all about, you know, the younger kids. It was about kids with in preschools and things of that nature, because that was a big push. You know, that's who was in the area. DeSoto County was very young at that time, and so there was a lot of younger parents moving in, and this new diagnosis was being thrown around. And so what I learned from that experience is that these kids eventually get older. And so we started providing services in the school system, because parents was like, hey, you know, little Johnny still needs a little help. Can you help us? And so we moved to working within the school system. And then eventually what happened was even those kids get even older. And so some graduated. So now some are on the IDD waiver. And so now we have adults with autism that we still provide those services with. But the beautiful thing about it is some of those same kids that we work with no longer need services. And that's what our ultimate goal is. Now, that's not saying that that's everyone's standard, but we want to provide services to where parents don't need us anymore. And when we talk about socially significant behavior, that's what's important to the parents, not what's important to us, if you will. I want to know what goals you want to work on, and that's what we do. That's socially significant to you. It may not be to the next parent, but whatever it is for you. So those goals, if you will, are individualized. It may be you being able to take Johnny to Walmart without having a tantrum. If that's what you want to work on, then that's what we will work on. You know, another parent may be able to go to Walmart all day long, but they cannot have Johnny sitting at the dinner table. And so that's socially significant to that parent. So those skills is what we work on. And again, no two ABA programs are going to look alike because no two children are alike. And so whatever it is that you're working on, that's what we decide to work on. One thing that I think a lot of parents have in common is that, you know, they feel this, and I think it's just parents in general, we feel this guilt trip, like we're not doing enough as parents. But I can assure you, when I heard Miss Antoinette talking about taking away an iPad, and I heard Miss Robin talking about, you know, the kids not sharing, I felt that as well. My kids don't share. My kids, when I take away iPads, have tantrums and things of that nature. And so I think that's common among all parents. And so we can work on these things together. I think that the ARC does a great job of giving out resources to parents so that they feel supported. Because I assure you, if you're having an issue with behavior, there's another parent that's having the exact same issue with behavior. And so putting these resources together so that you guys can talk amongst yourselves as well is very critical. DeTerrence, when he first started his intro, he said he is not an expert. I don't think anyone is an expert. I think that we all may have various things that we bring to the table, but in my opinion, I think that we're lifelong learners. And so an individual can teach me something every single day and that I didn't know the day before. And so we utilize those experiences over and over again.
Thank you. I appreciate your insight. And one thing that I think that you hit on is what happens in a ABA session. And so there's a lot of misconceptions of what parents and what other providers think should happen in a session and what actually does happen. And so I think that that's a great segue for us to talk about things that happen in sessions. You have development of functional based skills. You also looking at the development of replacement behavior. So Vargas was talking about being able to teach Johnny to be able to wait and being able to ask and say, hey, I need help when I do this type of math problem. Or I need help, you know, when it comes to navigating my way in the classroom. And so we'll teach those skills during that session based off of the behavior support plan. And then parent support. So if you are receiving ABA's services, there's always this caveat of parent support. We want to make sure that we bring parents in. You shouldn't be going to ABA therapy for 2 and 3 years and never having a sit-down conversation with your behavior support provider. You want to make sure that you're utilizing all aspects of that support, because we can only change so much in clinic. The power or the notion of ABA comes from our ability to train other people to do those skill sets. And so, Ms. Antoinette, during ABA, what would happen would be, you know, we will train your child to respond a certain way, but then we'll also train you how to consistently implement some of those techniques and to do it in the appropriate fashion. And so what eventually will happen is we're fading ourselves out. So maybe, you know, this month you got 30 hours of support, but in 3 months down the line, you only need 15 hours of support. And then from there, you only need 2 hours. And after a while, we're only providing a follow-up visit. Hey, this year, Johnny's going to a new grade. Can you come in for a few weeks just to help us, to get us kind of reacclimated to what the expectations are? So this lifelong process of now we started out heavy, but now we're not using as much support because the behaviors have changed. Also looking at reduction of problem behaviors. And so we want to make sure that, during this time, we quantify and we look at what the problem behaviors are, and then we're reducing them. You should see a change in sessions. You should see a change in the behavior, your skill set. When Johnny has a tantrum now, you're equipped to be able to address that behavior for 10 to 15 minutes. Now you're equipped to be able to handle that behavior while you're in the grocery store. And so not only the problem behaviors of the individuals, but increasing the skill set of the parent as well. Also, data collection. Our RBTs and BCBAs and BCABAs are all skilled at being able to collect that data, and we're going to train parents how to collect that data so that they can see the change as well. So, and also being able to do a preference assessment. Sometimes we think we know what our kids want, but what I've learned with my child is a lot of times I have not a clue. And so sometimes I have a 2-year-old, and a lot of the times I think I know that he loves Coco Melon and Thomas the Train, but I found out he doesn't even like those things. It was just what Daddy was into at the particular time. So like I said, I had to kind of figure it out, and all of that just comes from being a detective. We're really just trying to figure out what it is that person wants. And so it's asking questions, it's observing their behavior. When I give my son the iPad right now, the behaviors decrease. And so he's not crying as much. And so now it's, so I can use this as an incentive. But there's not a greater incentive than me telling him good job, because he really loves that socially mediated attention. He likes for me to praise him. He's 2. He really is enjoying that. And so he's going through that phase of really understanding that, when we're sitting at the table, there are certain expectations. And so those things came from us developing what his preferences were. Things that you also look at, like I said, reinforcement assessments which are very similar to preference assessments. What you won't see during, or you shouldn't see during an ABA session is counseling. We are, although we're skilled at behaviors and reducing those things, it's not a counseling session. It's not for us to therapeutically talk about problems that are outside of the scope of what we work on with your loved one. And I think that's maybe one of the biggest misconceptions. Would you agree, Vargas?
Yeah, absolutely. Absolutely.
And from there, also knowing that it's not talk therapy, and also it's not babysitting. We really gear our sessions to really attack some of those problem behaviors. And so this is hard work that we're putting in together, but it's not something that I'm independently just allowing your child to have access to the iPad and the phone and all the preferred things for 2 or 3 hours straight. This is heavy lifting. This is, Vargas in his prime would throw a kid up in the air and the kid would love it. I don't know if it's happening right now, but but that ability to work in that control setting so that we can see some of those meaningful changes are crucial. And so it's a collaborative approach. And so it's not where you just you drop a kid off with us for 3 or 4 hours, you go to a grocery store. Well, at some point we're gonna have to bring you in, Mom. We're gonna have to bring you in, Grandma, so that we can talk about these things, so that I can show you these things, so that I can give you my insight of what I have observed, and then you tell me, hey, is this working? Is this not working? And so that way we can come up with a solution that's going to be impactful for your family.
Yeah, I'm jumping in real quick as well, DeTerrence. So one thing that I think parents is that having a working relationship with your provider. And so if there's some things that you don't feel are working, communicate that as well, so that we can either A, change some things up, or B, make sure that we're implementing those procedures, as we had written those things. Another thing that I think is critical, what is wonderful actually, is that some insurances within the state of Mississippi allows us to go into the home. So we're actually able to go into where the behaviors are occurring. And so I think that that's critical because, again, now we'll be on your home front, if you will. And so we're able to assist you guys there. It's not us just talking about it. Miss Antoinette, you said, wow, your son was at school. He's a model student. But then when he comes home, and we call that behavioral contrast. There's things that he's not doing at home that he would typically do at school. But we'll be able to address those things. And again, that's depending upon insurance. They kind of lay the law of the land, but we do have that option if that is what is needed.
Okay. The best part about the therapy in home is that in the clinic setting, you can tell a parent all day long that this is how you should say these words, do this thing. But when you're in the actual house and you're watching the parent live actually trying to do it, and then being able to say to the parent, no, do it this way, or no, put your hand right here, or say it with this sound in your voice, it's so much more dynamic and effective. So
absolutely,
I really wish all the insurances would get on board and allow that to happen. But I mean, we just have to live in the system that we're in. So
well, I think that you guys are the driving force. Parents and stakeholders are what changes the ability of the pay sources or the insurance companies. And so until up a few years ago, Vargas, am I right? We didn't have the licensure in Mississippi, and that was really driven home by stakeholders. We're saying we need certain things to be mandated in Mississippi, and stakeholders like the ARC and parents were rallying at the Capitol to make sure that these things happen. And so it's nice to hear it come from behavior analysts and the behavior analytic community, but where real change happens is when parents say, well, you know what, I'm not going to get my insurance through Cigna because they won't allow me to do this, or we're not going to get insurance through these providers because they're not allowing these things. And so that's how I think the change comes about.
Yeah, I think honestly, up until just a few years ago, insurance was not mandated to provide services for children with autism. And so, Rebecca, I'm sure during, when your son was younger, there was a lot of out-of-pocket costs, that was going along as well.
Yep, it was a killer. And that was why, in the end, I had to figure out how to read the book and do it myself because there just wasn't the resource. There just wasn't anybody there to do it for me.
And with that being said, some insurance companies still will not or will try to rebuttal. And so as parents, I think that it's important that you align yourself with associations like the ARC so that they can help you advocate for yourself, because I don't know how many times we've received denials and the state clearly mandates that autism be covered under insurance. So you have to be able to speak up for yourself, to speak up for your child as well. And I know it kind of gets off topic of what ABA is, but at the same time, I think it's an important thing to know.
Rebecca, I have a question. This is Antoinette. Are there the services that ABA provides, do you all help with maybe helping us to find supplemental resources that can help to provide ABA sessions, financially, if we could get assistance with ABA? Is there, okay, I'm looking at that now. Okay, because there are a lot of insurance. My son I don't have insurance. I have CHIP for my son, or the state insurance. So I'm not sure that would be something that,
The state, it does, all of the Medicaids provide ABA, right? DeTerrence and Vargas?
Yes, that's yes. Correct.
Yeah.
Mississippi CHIP, Mississippi CAN, and regular Medicaid. I think there's Magnolia, Molina as well. But yes, every entity of Medicaid is covered
Okay.
under for autism.
And what I'm going to do is, like I said, Rebecca, this is a list of contacts or resources, but I'm also going to show you how to find providers, and also being able to show you that I'm going to also give you my information as well. So if you can't navigate the website, you can also contact me, and if you're interested, we can kind of take you through our process as well. Hold on one second.
And while DeTerrence is doing that, and Terrence, if I'm out of bounds, let me know. But are there any other questions, I guess, as it relates to what ABA is and the credentialing or providers or anything of that nature?
The trick to ABA is, if you want ABA for your child, is to get on a list and keep trying to get the service, because even at Mississippi Behavior Services, they have a waiting list. But I always, and you know, Vargas and Terrence, you can yell at me for this, but I always tell people when they're on the waiting lists, they should call every other week or every week and just say, please don't forget me. Is there a slot open yet for me? So just to keep you in the forefront of the clinic's mind, how serious that you are, and that when a spot comes up, that you jump as hard as you can to get into the spot. So
yeah, no, I'm not gonna yell at you, Rebecca. I mean, it hit something inside of me, because honestly, that's true. You know, we do have a wait list, but it's a stagnant list, meaning that it only moves when a spot becomes available. However, if there is a parent that's expressing need, that I hear in my ear, you know, hey, I remember this parent called twice. Sometimes, you know, that will make us go ahead and move and see some things that we can do. So by all means, I think that's very pertinent. Yeah.
I definitely agree, particularly with being able to communicate the needs. So even if we can't provide the service right then, there's been times when we've done parent trainings, because we've had multiple parents that are on the waiting list that are experiencing some of the same difficulties, and so we're empowered by the families, and so that phone call sets a alarm off of my ear as well, saying that, hey, I have 3 or 4 parents right now that are on a waiting list that have similar difficulties right now. Let's see if we can do a training for the community. And that's really how this training came about. Was a few parents called and were telling me, well, I'm on your waiting list, but well, how does this process even work? What is it to be a BCBA, and I just want to know how to navigate this. And so that's how we ended up getting here. And with that being said, if you go to the BAM's website, you're able to go to service providers, and it's broken down by regions. And so DeSoto County is in Region 1, and here are a list of clinics that are available. And so there's the Autism Center, Golden Triangle, Autism Development at Mississippi State, Integrated Health, King's Therapies, and Mississippi Behavior Services, which is us. I'll put a star by that agency. I know that they're pretty good. And then if you're looking for an individual provider, you can go to, hold on one second. So agencies are the way to go, but sometimes individual providers will provide just a one-on-one consultative services. So if you want to find a BCBA, or if you just want to know if a BCBA is credentialed, you can go and you say, find a certificate on the BACB website. And they have these really cool, neat option. You go to general, you go to BCBA, BCBAD, and you put in your postal code. And let's just say DeSoto County is 38671. And I'm gonna do within a 25-mile radius. And I'm gonna search. and it's going to find every BCBA in a 25-mile radius that, and look there's my name, that that's able to provide service. And so just making sure that you connect with those individuals, and sometimes they're able to kind of help as well.
So I know that you guys are seeing on that list that that's hitting so many more people in Tennessee than it is in Mississippi. And just to help you understand that the Tennessee market, there's different reimbursement rates for BCBAs, and in Tennessee, the rate is a little bit higher. So people flock up there.
A lot higher.
Yeah, and so that's why our rate here is lower, and it's hard for us to maintain service providers. And that's why at every chance I get, I'm talking to our state senators and our state representatives about our low rate and how we can't get qualified people. We're so thankful to Mississippi Behavior Services and to Integrated Health for, at least having services here and not taking them over to Tennessee, because we would be in so much trouble without them.
Yeah, one thing, there's only, I want to say 75 licensed behavior analysts in the entire state of Mississippi. So, everywhere you go, guys, there's going to be a wait list, like Rebecca was saying, but definitely continue to call, pursue, and there's new individuals coming, but again, we're competing with Tennessee, we're competing with Louisiana, Arkansas, and all of the surrounding areas. The rates are significantly higher than what it is here in Mississippi.
One thing I really wish that the Mississippi schools that are certifying BCBAs would make it a requirement that people, like if they get scholarships or something, that they stay in the state for a while to practice, because it doesn't do us any good when Southern's turning out people and they're, leaving immediately. So.
Yeah. And it's one of the things that we were fighting with, like I said, and the reason why Vargas and I have stayed in Mississippi is, and predominantly provided service only in Mississippi, is because we're homegrown. We've seen what the trenches look like, and we've seen the deficits. And like Vargas was saying, there's only 75 or 80 licensed behavior analysts in the state, and in DeSoto County, it's not a hot spot. A lot of those 75 individuals are located in the Jackson area or on the coast. And so if you're looking for a licensed behavior analyst in Mississippi, you can go to the Mississippi Autism Board, and they have a list that is available under list licensed behavior analyst. And so if you go to Mississippi Licensed Behavior Analyst, you'll see a current list of everybody that is licensed and their licensure date. So like I said, you'll be able to see that there's not, just at a glance on the first page, there's only one person in South Haven. We gotta make sure that we get some more providers out this way. But that just speaks to the need of this area as well.
All right, well, I see that we've gone over a little bit. I appreciate you guys so much for doing this workshop today. Thank you so much.
We appreciate having us here.
All right, so does anybody have any parting questions or no? All right.
I appreciate it. Thank you.
Sorry.
Thank you so much.
Okay. Have a great day, everybody.
You too. Bye-bye.
Bye.
Bye-bye.